Hello, my name is Dr. Olubukola Ayodele. I'm a breast oncologist, which means that I treat breast cancer. Today, I will be talking to you about signs and symptoms of breast cancer because empowering yourself by knowing potentially what you can find or things that can signpost you to a potential diagnosis of breast cancer is really important. Knowing the signs can make a big difference. So here are some of the key symptoms or signs that you can look out for. One the most common one is lump in the breast, but I usually tell people that it's not just the breast that you should look out for. You look for underneath the arm, on the side of the breast itself, and also in your neck and collarbones. That could also have lumps in it. So when you're examining, you need to examine your neck, your collarbones, the breast itself or the chest if you're a man, underneath the arms, and also around the sides, because a lump can form in those places. The other things to look out for is the shape of the breast, or a swelling in the breast, or skin changes. These are all important signs that could indicate breast cancer. For the skin, you're looking for any ulceration, you're looking for any rash, you're looking for any dimpling, you're looking for any change like a orange pill that we call peau d'orange. These are all potential signs of an underlying breast cancer. The other things to look out for is the nipple. You can have a pulling inwards of the nipple, or you could also have discharge from the nipple. The discharges that we normally would see would be bloody discharge, green, yellow colored, but any discharge or anything you're uncomfortable with, please go to your GP as soon as possible. It's also important that you look out for pain. I know that this is not typical, but we've discovered that in some cases, a pain can show up and then a few weeks later or a month later or a few months later, the actual lump will show up. So people can have breast pain without a lump, and that could potentially signal a problem. So this is really important. There's also one where the whole breast becomes quite inflamed, and that could be a sign of what we call inflammatory breast cancer. So these are some of the simple things you can look out for when you're doing your self-breast examination. One of the best things that you can do for yourself is to know your normal, and that way you can know what's abnormal. And if you do find anything abnormal, please pop into your GP or into your family doctor as soon as possible. So until next time, keep checking, keep sharing, and don't keep silent.